next we'll be looking at the assessment of inferior glides as well as the treatment. So with the inferior glide, what you can do, especially when it's an angle 90 degrees and lower, maybe even 100 degrees and lower, you want to stand next to your patient. My right hand is going to be cradled underneath the elbow. And then his forearm is just hugged against my body in relatively neutral rotation. So what my left hand is going to do, similar to the AP mob, is I'm finding the end of his AC joint, and then I'm just going to drop off a little bit where the head of the humerus will be. So I'm going to cup my hand like a C. I'm going to even provide actually a little bit of distraction, maybe a grade 1 distraction. I'm in a staggered stance. And then he's in 90 degrees abduction, and I'm just weight shifting forward. The same rules apply, just take up the slack of deltoid, and then you're going to shift inferiorly, R1, R2, R1, R2. Now, if your patient is very limited in abduction, they don't have 90 degrees, I'm just going to change the angle. So now, let's say I'm about 45 to 50 degrees of abduction. Now what I need to do is just move respective to the joints. So hopefully you can see by the way I'm standing here, I'm just shifting my weight forward. As I change the angle, now my body position is changed too, and I'm still shifting inferiorly. And this is without Dr. Diaz's arm. I'm just shifting in the direction of however the arm is placed. So with his arm at 90 degrees abduction, I'm just shifting forward. When his arm is a little bit lower, I'm turning my torso. So then now my arm is in line with the head of the humerus in the glenoid. Now, let's say it's assessment or really intervention as far as like, okay, it's that last little bit of maybe abduction that he's having pain, and you just want to really address it at its end point. So notice now I have his arm in a little bit more abduction, probably about 120, almost 130-ish. Now my handhold is going to change just to have a little bit more control of the arm. So my right arm is along the distal end of his humerus. I'm going to be using both hands like this to mobilize. I'm finding the AC joint, just dropping down a little bit, weight shifting to give a little distraction, and still moving in the inferior direction. So R1, R2 for assessment, R1, R2. And then for intervention, just do your grading accordingly. And don't forget to also check in with your patient with an intervention and see how their symptoms are.